Good afternoon, everyone, and welcome to our webinar. I'm Malia Schultzman. I'm a staff attorney with ChangeLab Solutions. For those of you who aren't familiar with our work, we partner with community leaders and policymakers to implement creative legal and policy strategies in order to improve the public's health. Please contact for any questions you might have or technical assistance that you might need to support your work in reducing tobacco use and secondhand smoke exposure. Just some quick fine print since I am an attorney. I wanted to let you know that the information I'm providing today is not intended to be legal advice, but we hope that you will find it helpful. And I'm now happy to turn it over to Mary Strode of the California Department of Public Health for some welcoming remarks.
Thank you, Malia. Welcome to today's webinar, everyone. The webinar is titled Get Plugged In, Taking Tobacco Retailer Licensing to the Next Level. I'm Mary Strode, the State Act Coordinator for the California Tobacco Control Program, and I have the pleasure of introducing our panel of speakers and reviewing the agenda. But before I do that, I just want to say that California has made tremendous progress with local tobacco retailer licensing over the last 10 years or so. As of last July, there are 94 strong TRL policies on the books in cities and counties all over California. This is outstanding, and progress is continuing. Regarding the new retail environment campaign, which is called Healthy Stores for Healthy Communities, TRL is one of several strategies on the menu of policy options for local projects. Therefore, today's webinar has an incredible amount of relevance to the future of tobacco control in California. Without further ado, I will now introduce our speakers. Starting things off will be Malia Schultzman, Staff Attorney at ChangeLab Solutions. Malia's presentation will address options for local TRL ordinances. Following Malia's presentation, Derek Smith, Project Director of the Tobacco Free Project in San Francisco Department of Public Health, will talk about San Francisco's Tobacco-Free Pharmacies project. Then Denise Dennis, Project Director of the Tobacco Prevention Project, Contra Costa Health Services, will address how Contra Costa County updated their TRL policy to regulate e-cigarettes. Following Denise's presentation, speakers will address questions and comments from the audience. Feel free to type your question or comment into the chat box at any time during the webinar. The chat box is the only way participants will be able to share comments and questions during this webinar. Malia will then wrap up by highlighting some key resources and providing a few closing remarks. Once the webinar is over, ChangeLab Solutions will send a link to the webinar page to everyone who registered. That page will include all of the slides, supplemental materials, and a recording of the webinar. Also, it will include a link to the webinar satisfaction survey. Please take a moment to provide your feedback on today's training via the brief survey. We'll really appreciate your feedback. So thank you all for being here on this webinar, and I hope you enjoy it. I will now pass the baton over to Malia.
Thanks so much, Mary. As I mentioned earlier, I'm a staff attorney with ChangeLab Solutions, and I focus on policies and strategies regarding tobacco sales and the retail environment. I'm happy to have any questions that you might have regarding sales restrictions for tobacco and ways that you can improve your community's tobacco control policies. As Mary mentioned, we have a lot to cover today. And to begin with, I'm going to give a very brief overview of what tobacco retailer licensing laws are. And then we'll spend the bulk of our time talking about how you can take your tobacco retailing licensing law, or TRL, to the next level. And finally, we'll end with some great examples from our local speakers on what their communities did to take TRL above and beyond a basic retail licensing statute. So as I mentioned, I'm going to do a very brief overview of TRL. I know that many of you are familiar with this material, but for those who aren't, we just want to make sure that you all are on the same page. So to begin with, what exactly is a TRL? As many of you know, licensing is a very common policy tool that state and local governments use to regulate individuals and businesses like pharmacies, restaurants, and alcohol retailers. And the idea is that if you're engaging in an activity that could affect public health or safety, you need to meet some certain minimum requirements. And a TRL fits right into that idea. The idea is that a business needs to obtain a license from the local government in exchange for the privilege of selling tobacco. In other words, there needs to be a demonstration that the retailer is going to comply with responsible business practices before they can engage in the privilege of selling tobacco products. So why have communities taken this approach? In some, the youth sales rates in California are still too high. And we know that in California, a majority of smokers start by the age of 18. And this has a huge impact on public health. Fortunately, we've seen evidence that TRL ordinances work and that they help prevent youth sales rates and reduce the youth sales rate. Our partners at the Center for Tobacco Policy and Organizing, also known as the Center, created this great chart, and this is an excerpt from it, showing that in communities that enacted TRL law, the youth sales rates went down significantly after the passage of that law and its enforcement. The state of California has recognized the effectiveness of TRL laws, and they are one of the policy strategies for the Healthy Stores for a Healthy Community campaign. I now want to talk about the 4 basic elements that are a part of a strong TRL policy. And we've worked with the Center to identify these 4 policies. And the first piece is that all retailers need to be required to obtain a non-transferable license that has to be renewed annually. The second piece is that jurisdictions should enact a licensing fee that can cover the cost of administration and enforcement of the TRL program. The key here is to have some source of guaranteed funding year after year that can help you with the enforcement costs. The third element is probably what I would call the meat of the TRL. And this is the idea that if you violate any federal or state tobacco law, that also constitutes a violation of your local TRL license and can result in suspension of your license. And I'll go into this in a little bit more detail. Many of you probably have heard in your local communities the argument that a TRL isn't necessary because we have all these other state and federal laws on the books. And for example, we have laws about self-service displays, sales to minors. We have laws that prohibit sales of individual cigarettes. The issue, though, is that these laws all have different penalties. They have different enforcement schemes, and sometimes enforcement doesn't even happen. And the other issue is the penalties for violating these laws are sometimes small fines that aren't significant enough to compel businesses to comply with the law. And so what can we do about the fact that we have all these laws on the books, but they may not be effective at preventing sales to youth? That's where your local TRL comes in. Basically, the TRL is this binder that consolidates all of these different federal and state laws into a single enforcement program. And that gives a lot of control to local governments. If by doing this, by enacting a local TRL law and by making sure that violation of any federal or state law can result in suspension of the local license, it gives cities and counties more power over enforcement. So we go from having these scattered federal and state laws to having a combined local policy and program that is an effective tool for enforcing everything. The last piece I want to talk about, and the fourth piece, is that even if you have a great TRL law, it's only going to work if it's enforced, and that's why you need to have some meaningful penalties. And by meaningful, we typically mean suspension. Communities have found that suspension is an effective deterrent at preventing retailers from violating tobacco control laws. They simply do not want to lose the profits that they'd receive from selling tobacco for a 30-day or 60-day period that could result from a suspension. So those 4 elements are basically the bare minimum requirement for a tobacco retail licensing law. And we have a model policy that includes the 4 elements that can help get you started if your community doesn't yet have a TRL. And this is on our website. So as I mentioned, the TRL is a great tool. And the 4 elements we just discussed are the basic building blocks for creating a really effective ordinance. But there's just so much more that you could do with a TRL. So let's think of it this way. The TRL is your basic smartphone. You can use it to make calls and send texts. But just like your smartphone, you might want to customize your local TRL to meet the special needs of your community and to make it even more functional. So we have these optional plug-in policies that can be used to enhance your local TRL ordinance. And I like to think of the plug-in policies as the optional apps that can be added to the smartphone or the TRL to make it even better. So these plug-in policies are like Facebook, Angry Birds, Twitter for your TRL. They're the extra features that make the TRL lots of fun and super helpful to you. This summer we actually revised the plugins to make them much easier for you to use. They're combined into one streamlined document. And each plugin has a policy rationale that explains why a community might want to adopt it. We've also provided expanded and updating findings that support each of these optional policies. And so now I'm going to go into the optional plugin policies in detail. So as I mentioned, we have these plug-in policies to help enhance your local TRL to take it above and beyond the basic model. And we've divided them into 2 big categories of policies. First, we have eligibility plugins. And these are basically plugins or policies that restrict who can get a license and where they can sell tobacco. There's a second set of optional plug-in policies called requirements and prohibitions. And these are additional requirements that you can mandate that retailers comply with after they've received their tobacco retail license. So let's start with the optional eligibility policies. Again, these are additional restrictions that you can add into your local TRL law that control who can sell tobacco and where they can sell. And I'll go over a few of these to give you a sense of some ways you can limit who is eligible to sell tobacco. So one of our newest optional plug-in policies for the TRL ordinance is tobacco-free pharmacies. As part of your TRL, you can state that businesses containing pharmacies are not eligible to obtain a tobacco retailer's license. And there are several reasons why a community might want to adopt this policy. First and foremost is that consumers rely on businesses that contain pharmacies for health-related services and products, such as the cessation aids that you can see in this photo of a pharmacy. And as a result of that, tobacco sales at these businesses really convey a mixed message to consumers. Derek is going to explain more about San Francisco's experience creating tobacco-free pharmacies in our next segment. Another way you can limit who is eligible for a local TRL license is by customizing your ordinance to say that businesses that operate near schools or youth-populated areas cannot obtain a tobacco retail license. So for example, we have a picture here of Crescent City youth who advocated for a policy that would prohibit tobacco retailers from being 1,000 feet of schools, parks, and playgrounds. And the reason why communities are interested in this is that studies show that tobacco sales near schools and child-oriented areas can increase youth smoking. To give you another visual of what this looks like in practice, here's a high school, and then here's the 1,000-foot buffer zone around the high school. And if you enacted a policy similar to the one in our model plugins, no retailer would be able to sell tobacco in that orange buffer zone area. Another example of how a local TRL law could be used to limit the number of licenses in your community is by enacting a limit on location. A lot of cities and counties are concerned about the number of tobacco retailers in particular neighborhoods. And so one option that you could incorporate into your local TRL law is to say that new retailers cannot open shop too close to an existing retailer. So you could prohibit a license from being issued to a new business that is, for example, within 500 feet or within one city block of an existing tobacco retailer. So you'll see from this example on the slide, this is San Francisco's Mission District, and each green dot represents a tobacco retailer. You can see that a lot of the dots are very close together. And so this plugin would prevent new tobacco retailers from adding to that problem by opening business too close to these existing retailers. And Derek will touch a little bit more on density in his piece of the presentation. Another way you could use your local tobacco retail licensing law to restrict and limit the number of licenses issued in your community is to put a population cap on the number of licenses that you will issue. So you could include language in your TRL stating that the total number of licenses issued in the city or county will be limited to 1 per 2,500 residents, and that number could be adjusted to meet your needs. This concept is very similar to state law regarding alcohol retailers. Under state law, the number of alcohol licenses that can be issued in a particular city or county is limited based on population. As an example of a community that actually did this, Huntington Park enacted a population cap of 1 tobacco retailer license per 1,000 residents. With their population at 59,000, this would result in a cap of 59 licenses in the city. They're actually currently over this cap. They were over it before they enacted the licensing law. So currently, the way that they're implementing this is they're not issuing licenses to new businesses that want to sell tobacco. I bet many of you have seen these types of stores or similar ones in your community. And I know that many cities and counties are concerned about smoke shops and discount cigarette stores opening up shop. A tobacco retail licensing law can address this by stating that businesses that primarily will sell tobacco are ineligible for a license. One reason why a community might be interested in this policy is that tobacco shops, which are shown here on the graph as a tobacco store, were recently shown to have very high rates of sales to minors. And you'll see another category that had higher rates of sales to minors are non-traditional retailers like restaurants, donut shops, and delis. Another way you could restrict eligibility for a TRL license is by adopting a policy saying that businesses that sell food for on-site consumption are ineligible for a tobacco retailer license. And the idea is just to get at those non-traditional retailers who are violating youth sales laws. So all those policies I just went over are examples of policies that can be used to limit who can sell tobacco and where they can sell it. As a community, though, you may also want to enact some policies that add some additional restrictions and prohibitions on licensed retailers. So this second set of policies I'm going to talk about are about sets of rules that businesses have to follow once they get their tobacco retailer license. And the idea is to further enhance your local tobacco retailer law to address local public health concerns that are related to tobacco retailing. So I bet a lot of you have seen these products in your community, cheap individual cigars, often fruit flavored or candy flavored and appealing to kids. A community could address these tobacco products as part of their tobacco retailing licensing program by adopting a policy saying that retailers are prohibited from selling individual cigars and that cigars must be sold in a minimum package size. For example, you could say that retailers can't sell cigars in packages of fewer than 5. And the reason why is that this could help raise the price of cigar products in your community and make them less appealing and accessible to kids. We are happy to work with you to help tailor a policy that fits the needs of your community. At least 2 cities in California have adopted restrictions on sales of individual cigars as part of their tobacco retail licensing law. We're also currently working on a model policy to address flavored tobacco products. I know there's a lot of interest in that, and so stay tuned. We'll let you know once we finalize that policy. Drug paraphernalia is another area where we receive a lot of questions from communities. And people often want to know what they can do locally about this because they see that many stores that sell tobacco are also selling drug paraphernalia products. One way to address this is to include a provision in your TRL stating that licensed retailers have to comply with all state drug paraphernalia laws. And if they don't, they're subject to the penalties of the TRL, such as license suspension. Several communities have adopted this provision throughout California and have used it to suspend tobacco retailers' licenses when the business is selling drug paraphernalia. Another restriction that you could enact on a tobacco retailer as part of your local licensing program is to enact some requirements regarding signage. And one way in which you could do this is you could include a policy as part of your TRL stating that licensed tobacco retailers cannot cover more than 15% of their windows with signs of any kind. And that percentage could be adjusted to fit the needs of your community. As many of you know, state law already prohibits liquor stores from covering more than 33% of their windows with signs for public safety reasons. And that same public safety rationale applies to tobacco retailers. The idea is that we can reduce crime within these stores if law enforcement can see the store interiors. Another rationale for why a community might want to adopt this policy is that businesses are less likely to violate laws regarding sales to minors and other tobacco laws if law enforcement and the public can see inside the business from the street. So you may have heard that New York City recently introduced legislation in its City Council to raise its tobacco purchase age to 21. And in response to that growing interest in this policy, we developed this plugin. And so basically a city could make it a violation of its local tobacco retail licensing law if a licensed retailer is sold to a purchaser under the age of 21. There are several reasons why this type of policy is gaining traction. And it has a lot to do with young adults and the specific tobacco use issues that are unique to them. So first of all, we know that in recent years, young adults ages 18 to 24 have had the highest smoking rate among any age group in California. And we also know that most young adults smokers in California start by age 18. We also know that the industry has historically targeted young adults, as you can see from this slide. Another factor in play is that most individuals transition from experimental to regular smoking by around age 20. So the idea is that by delaying the age at which people begin to smoke, it's possible that we can prevent them from ever taking up the habit. This type of policy can also help protect minors, since high school students are less likely to have 21-year-olds as part of their social circles than 18-year-olds, making it more difficult for them to get cigarettes from peers. So while we're on the subject of enhancing your TRL, many communities have expressed interest in regulating e-cigarettes. Our model TRL policy requires a license to sell any tobacco product. And in 2005, we revised our model TRL to broadly define tobacco product to include anything that contains biologically active amounts of nicotine. And so that definition is broad enough to cover e-cigarettes and other emerging products. And by defining tobacco product that broadly, It makes sure that retailers can be required to get a TRL before selling these products in your community. We're happy to assist cities and counties that want to look at their local TRL and make sure that it covers e-cigarettes. And additionally, we recently released a model e-cigarette policy that, among other things, prohibits sampling and self-service displays of e-cigarettes. Additionally, our partners at the Center recently released a document that lists the 48 cities and counties in California that require a retailer license to sell e-cigarettes. And so as you can see, there's a lot of resources out there right now for addressing these emerging products. And additionally, Denise is going to share more about Contra Costa County's recent experience in regulating e-cigarettes during her presentation. So to wrap up, I'll talk about some of our products. We have a checklist that covers a lot of the elements I talked about today. As part of that checklist, you'll see a list of all of the plugins I discussed, plus a few more. We also have some fact sheets. The first one gives a great overview of TRL laws, what they do and why they're effective. And the second summarizes all the plug-in provisions that I discussed today. So thank you everyone for your time. And as I mentioned, we'll continue to take questions via chat and get to them at the end of our presentation. But for now, I'm going to turn it over to Derek Smith.
All right. Thank you, Malia. As Mary introduced me, I'm Derek. I'm with the San Francisco Department of Public Health. And today I will be speaking with you briefly about the issue of tobacco-free pharmacies in San Francisco. All right, so first up, just an overview of what all happened in San Francisco. In 2003, San Francisco adopted a tobacco retail licensing ordinance, just as Malia outlined, the sort of basic ordinance that provides some sort of overview and supervision of all retailers that are selling tobacco. In that tobacco retail license, like all, essentially retailers are agreeing not to break federal or state laws around the sales of tobacco, and our particular concern is that they're not selling to minors, right? In 2008, San Francisco strengthened that ordinance by adding on something just like a plug-in, like Malia was mentioning, to our existing tobacco retail licensing, which disallowed the issuing of a tobacco retail permit to any establishment that also had a pharmacy. And there's kind of some nuance here, but essentially what it said was that the 63 local Walgreens and Rite Aid stores that were selling tobacco, because they were substantially a pharmacy and they had pharmacy services in their building, they were no longer allowed to be permitted to sell tobacco products. Later on, I won't get into the technicalities, but later on this was expanded to grocery stores like Safeways that also had pharmacies after some legislation changes. So specifically, let's talk about why this is a problem. Why would anyone do this, take on this kind of challenging issue of taking on Rite Aids and Walgreens and all of these stores in changing the ways that tobacco users are used to being able to access this product at Walgreens and CVS and other pharmacy stores. There's a couple things. One is really the mixed message, and that is the tactic that we took locally of selling tobacco products, one of the most damaging products that, as all of us know, at an establishment that also was a pharmacy, so a health business. So it's this weird mix. As you see in the picture here, it's the products to help people quit smoking right next to the products to help people start smoking. It just doesn't make a lot of sense. Additionally, people entering pharmacies often are vulnerable. Particularly in San Francisco, we have a lot of lower income people who would maybe do a lot of their shopping at pharmacies. Additionally, they're probably there because they're filling up prescriptions, so they may already have a chronic disease. Most developed nations do not sell tobacco products in pharmacies, so all over the world, most pharmacies are places of health specifically, and it would just be ridiculous for them to also be selling tobacco products. Additionally, it's a social norm now that tobacco is available virtually everywhere, particularly in our community, at every single establishment, whether it's an odd little corner store, dollar store, a liquor store, a pharmacy, a supermarket. And so the increasing availability of tobacco in all store types just means that there's greater access. And as we all know, it means more young people are exposed regularly to tobacco products, as if though that's a norm and accepted in our community. So a little bit of information about pharmacies. This is all dug up as background on this issue. Prescription sales really are the reason that companies like Walgreens and Rite Aid are in business. So the prescription sales themselves make up more than 65% of their profit. So they're not making the bulk of their money from tobacco products. It's really added on as a convenience product. Most of the, when you go into a large store like a Rite Aid or a Walgreens, you'll see that most of the store is all the other stuff. It's lawn chairs and beach balls and soda pop and tobacco and other products. But the reason that that company exists is to be a prescription service, is to be a pharmacy. Additionally, I found this very interesting that pharmacists themselves, of course, are health professionals just as we are, and they not only agree that selling tobacco in drugstores is bad, so they've always had kind of a professional conflict with working in an establishment that also sells tobacco, beyond the fact that they themselves are professionally giving prescriptions and treating people who may be victims of tobacco use over many years and have a chronic disease. Part of our findings in the ordinance itself here states that all the way back in 1970, so 43 years ago, the American Pharmaceutical Association made a statement publicly that the mass display of tobacco products in pharmacies, stores, in places where they work is unacceptable. So for many years they've had kind of a slow-rolling opposition, but of course they aren't the business people who make all the decisions at the corporate level. So specifically, how this moved forward, to give a shout out to Bob Gordon of the LGBT Partnership, who I think is on the call, who did a lot of the legwork initially for this, really saw it as an opportunity to envision San Francisco as a place that didn't have tobacco sales in our local pharmacy, our local drugstores, and started doing some work to encourage private pharmacies. These are non-chain pharmacies, like independently owned small pharmacies, to not sell tobacco. And he got some traction in addition to researching existing pharmacy policies and in kind of creating some relationships with owners, with pharmacists, just kind of getting the ball rolling. Well, our health officer, Mitch Katz, became very interested and determined that this would be a citywide rule. And so again, from the findings, just some interesting background information that a majority of independently owned California pharmacies, and this was several years ago, 78% of independent pharmacies didn't sell tobacco. But on the flip side, 94% of chain drugstores, CVS, Walgreens, Rite Aid, any others, were selling tobacco. So it's really a tale of two pharmacies, right, where you have just a very different view of the role of a pharmacy and health as kind of a health-serving agency within a store that's there to make money. So after this passed, as I said in 2008, it took a little while with some legal issues, etc. But the Department of Public Health sent out letters to all of the stores that were no longer eligible for a tobacco retail license, and basically informed them, you're a Walgreens, for example, you are no longer allowed to sell tobacco. Certainly they knew that already at the corporate level, but at that point, the number of our retailers in San Francisco dropped by 63, because that's how many stores with pharmacies that the ordinance applied to would no longer be able to sell tobacco. So San Francisco was sued, and we won't get into all the details about this, but most of the arguments were dismissed, and obviously the ordinance still stands. And there was definitely some wrangling, but most of the arguments really came up from like the tobacco companies or Walgreens about First Amendment issues and the legality of being able to sell their product or advertise their product. Those weren't very persuasive arguments, because just because the tobacco product doesn't exist in the store doesn't mean they couldn't still put up posters or something and still advertise their product. They have every right to do that. So those didn't really stand as legal arguments against this ordinance. Keeping in mind, really, this is like a take-home message, that any policy proposal that our communities move forward really should be focused on that city or that county's desire to regulate where tobacco is sold, and not really on the advertising. So that's not really a good road to go down, particularly because of the concerns of First Amendment arguments. Really, it's about us saying these are places of health where our elderly folks in our community go. These are places where our kids, grab a snack or, hang out with their moms after school quickly to grab something. These are not places where we want to have a big wall of tobacco products right behind the clerk or right next to the pharmacy or whatever. So impacts. There is no longer tobacco sold at San Francisco stores that contain pharmacies. As you see, there's a photo here, which is pretty great for all of us in public health, that is an empty Marlboro rack. Like where once there were hundreds of dollars worth of tobacco packs from Marlboro, now it's just an empty rack, and it's no longer a harm to the public. And obviously later this valuable shelf space maybe was filled in with other products, electronics, something less harmful, or maybe even those, you see Nicorette gum and other products, maybe those moved over and there was more of a health message for this store that's, these stores that are pharmacy-based and health-based. One study in the journal Tobacco Control in 2012 looked at customer perspectives of the sales ban in San Francisco, and it found that 76% of people, after hearing about the ban of tobacco sales, said, oh, we don't really care one way or another. 13% said that they would shop there less, and 12% actually said they would shop there more. So this is pretty important because there's often these arguments about business and how impactful this will be. And this research really showed that all in all, it didn't make any difference. Additionally, there's some real circumstantial evidence that there have been a bunch of new Walgreens and CVS stores that have opened. So there's almost no change, no stores have gone out of business as a result of this, at least to my knowledge, but there certainly has been growth in the drugstore business in San Francisco despite the inability to sell tobacco. All right, so totally different turn, but a very, very brief introduction to tobacco retail density. Already Malia was mentioning this issue, but in San Francisco, the leadership of Youth Leadership Institute advocates have been working on tobacco density for over 4 years. And what this really means is that there's a lot of neighborhoods that are really grossly over-concentrated with far too many tobacco retailers. You probably know the areas in your community that are just like this. It's really a social justice issue, we believe, because youth are growing up exposed to more tobacco, are more likely, we know this from the research, to actually become smokers later. So in our community, we've really taken just a couple main steps. We've done some assessment, some research, and some initial negotiation. We don't yet have an ordinance around tobacco retail density, but there's been work for many years on this issue. So just some maps for you of San Francisco and where tobacco retailers are. You can see that they're clumped all over the place. So the youth did some data collection and decided to do this mapping for exactly the purpose of indicating to leaders and to their community just how unfair it looks, like on sheer basis of how many dots there are. On the right is a close-up of kind of the Tenderloin South of Market area, which is a lower income community that has many more dots, which means many, many more tobacco retailers. So this is their basic information. They've done other data collection. The other work that they've done is really looking at what's worked in other communities and kind of looking at other issues, maybe alcohol sales density, or maybe sales of drugs, or maybe sales of paraphernalia, really looking at connecting with other issues and how they came to a conclusion in their community. And then also trying to link to other groups. Really, we're looking at connections to healthy food in communities as well as the sale of tobacco. So there's kind of a partnership built in about transforming the community. Really, they're now working on making a plan about how to frame the issue and communicating with key players like legislators, store owners, health experts to kind of figure out what are the questions and concerns around all around this issue in general. Is it legality? Are they concerned about business, how the impact will be on small business? How do parents feel about the sales of tobacco in the community? That sort of thing. And right now we're also kind of working on sort of drafts of what might a policy look like that would move forward. And ultimately the big goal being reducing the number of tobacco stores that are kind of unjustly distributed in some of our lower income communities. So that's me, and I think we'll turn it over to Denise.
Thank you, Derek. So I am going to spend just a few minutes, about 10 minutes, about regulation of electronic cigarettes in Contra Costa. Electronic cigarettes, which most of you are probably familiar with, but they are battery-operated products designed to deliver nicotine. They often resemble the look of a conventional cigarette, including a battery glow at the end of the device. They turn nicotine, which is highly addictive, and other chemicals into a vapor that is inhaled by the user. E-cigarettes are currently unregulated by the state or by the federal government. The National Association of the County and City Health Officials are among groups urging the FDA to enact regulations overseeing the sale and the use of e-cigarettes and to conduct additional research on their health impacts. So there are a number of reasons why local jurisdictions should take measures to regulate these products. And first is that e-cigarettes may appeal to youth because of their high-tech design. They're easily available online and in convenience stores. They come in a wide array of flavors, including fruit flavors and chocolate and mint. They also may be starter products for youth, a gateway drug to other tobacco products. This is really central to including e-cigarettes as part of a tobacco retailer licensing effort. And it was one of the key points made to the Board of Supervisors by our public health director in March. If you notice I'm going to try to use this little dot. It's not doing it. If you notice, the name of this e-cigarette package is Crave It Starter Kit, and he was actually, it was a very convenient example to use with the Board of Supervisors, as this is actually being advertised as the starter product. Including e-cigarettes in TRL also provides the opportunity to enforce the no e-cigarette sales to minors law, and it may reduce the number of retailers selling these products, as e-cigarettes are popping up in places. We actually have found them in at least one health food store in our county. So there's also concern that use of e-cigarettes in public places and places of employment could cause confusion around enforcement issues in smoke-free areas, could trigger relapse in those that are trying to quit smoking, and could increase social acceptance to smoking, thereby eroding community norms related to the use of tobacco products in public places. So after about 2 years of work, Contra Costa did adopt new regulations around e-cigarettes in April, and we did revise our ordinance to require that all retailers selling electronic cigarettes have to have a tobacco retailer license in order to sell these products, and prohibiting the use of e-cigarettes wherever smoking is prohibited under the county's comprehensive protections, Secondhand Smoke Protections Ordinance. So the way we did this was we changed the definition of tobacco products to include any product or formulation of matter containing nicotine, which Malia actually talked about, is in the model ordinance. This definition covers other electronic nicotine delivery devices such as e-hookah, and again, it is included in the ChangeLab's model definition. The definition of tobacco products specifically excludes products approved by the FDA for smoking cessation, and this was discussed in the staff report to the board. Just wanted to clarify one thing about our ordinance here in Contra Costa. It was initially adopted in 2003, and while we may have been the first jurisdiction in the state to revise an existing TRL to include e-cigarettes, specifically, our ordinance has not been updated since it was adopted in 2003, and it doesn't reflect all the best practices in the plug-ins that are being discussed on this webinar. So please do consult with ChangeLabs if you are going to look at including regulation of e-cigarettes in your ordinance. The focus of today's presentation is not secondhand smoke protections, but I did want to mention that we also updated our definition of smoke and smoking in the county code to reflect the model secondhand smoke ordinance language, which ChangeLabs has in their model ordinances to address e-cigarettes as well. In preparing for reports to the Board of Supervisors, we did develop findings that were specific to e-cigarettes. There's currently excellent fact sheets available from several sources, including ChangeLab and NACCHO and CYAN, that can serve as the basis for findings and for reports to policymakers. Our board usually wants to know what other jurisdictions have similar ordinances, so we developed a list of the other communities that had similar language in their TRL or in their secondhand smoke protections ordinance. And we're really excited that the Center for Tobacco Policy and Organizing recently distributed a list of California jurisdictions that have this language that does include e-cigarettes. Jurisdictions that have language that includes e-cigarettes in their definition of tobacco products. And I expect that that's going to be very useful in educating policymakers. All of the arguments that we heard at the public hearing against the regulation of e-cigarettes were related to the prohibition of their use where smoking is prohibited. These included arguments about e-cigarettes helped me quit, so it's bad public health policy to take them away from me. Youth aren't being influenced by e-cigarettes either because they're too expensive or they don't look like cigarettes. They aren't being marketed to them. One of the gentlemen that actually used that argument had this device without this black covering, so it was like an 8 or 9 inch metal canister for his vapor, and he pulled it out of his pocket and showed it to the board and said, this does not look like an e-cigarette. So, you know, what we traditionally think about as e-cigarettes does come in several different kinds of forms, and you might want to be able to respond to that kind of a argument that may come up at a public hearing. And then the other issue is that there's no research supporting the ill health effects of secondhand vapors. The 4 out of 5 of our members of the Board of Supervisors supported regulation of e-cigarettes either through both licensing, required licensing of e-cigarette retailers, and prohibiting their use where cigarette use is prohibited. The board member comments included that there is a perception that if we were not to do anything about this, that it's okay to use this product, that we need to control how they are sold because we don't know if it's a safe product, and we don't want to go backwards by undermining community norms. No one from the public or from the board spoke about concerns about licensing retailers who sell who sell e-cigarettes. They were really much more concerned about the prohibition of the use of this product in places where cigarette use is prohibited. Finally, since the focus of this webinar is on tobacco retailer licensing, I did not go into some of the health concerns related to vaping. These issues are addressed in the fact sheets that are discussed. However, in Contra Costa's experience, the limited amount of research that was available on the health impacts of use and the secondhand vaping issues, we really decided that they could lead to debate between advocates both for and against regulation. While the Board of Supervisors was concerned about the preliminary research indicating the presence of carcinogens in these products and the fact that their safety has not been demonstrated, they were also very concerned about the potential of these products to normalize smoking or vaping, to trigger relapse among quitters, and to encourage initiation of tobacco use among young people. And I think that those community norm eroding arguments are themselves strong reasons for regulation among policymakers. And that is all I have. I'll turn it back over to Malia.
Thanks, Denise. So at this time we will take questions. Feel free to use the chat function to insert questions for any of our presenters. We're happy to discuss them with you. And I see that we do have a couple of questions in the queue already, so I'll get to those and encourage everyone else to submit those questions via chat. So the first question we have is whether hookah is considered tobacco. And what I'll say about that is hookah would fit into the definition of tobacco product under our model ordinance. It does contain nicotine, it does contain tobacco, and as a result of that, if there is a hookah bar in your community, they would be required to likely get a tobacco retailer's license if you had one in place and you were using a sufficiently broad definition of tobacco. And that's something that we're happy to help you look at if you have more questions about hookah. The other question was about the policy that we talked about prohibiting using a TRL to prohibit sales of purchasers who are under 21. And the question was, is that prohibited or preempted by the penal code, which is the state criminal law that prohibits sales to people under 18. And the penal code does preempt localities from enacting their own local criminal law that prohibits tobacco sales to minors. The idea of the penal code is that the state wanted control over criminalizing sales of tobacco to minors. However, the penal code doesn't preempt local tobacco retail licensing laws. And so while you as a community could not enact a standalone law saying that it's a crime to sell tobacco to someone under 21, what you could do instead, and this is a critical distinction, is that you could provide that if you have a tobacco retail licensing law in place, it's a violation of that tobacco retailer licensing law to sell to someone who's under 21. So you're not creating a new separate criminal law locally. What you're doing is you're adding something to your local tobacco retail licensing. And cities have quite a bit of discretion in terms of what they can include in their local tobacco retail licensing law. And so we're happy to provide more about that distinction if anyone wants to hear more about that policy. And I see that those are the only two questions in the queue. So I believe that I'll go ahead and wrap up at this time unless I see a few more come in at the last minute. So I wanted to thank our presenters today. I want to thank Mary Strode, Derek Smith, and Denise Dennis for all the excellent information you provided about your local communities. These are great examples of what people have done to take tobacco retail licensing to the very next level. I also wanted to thank our audience today because I know many of you are working on year-end reports, and we're forever grateful that you've taken an hour of your time to spend with us today to discuss TRL. The other thing that I want to say is that ChangeLab Solutions provides support to local advocates and programs and agencies that want to do more to address tobacco sales and exposure to secondhand smoke in their communities. Please do reach out to us if you need technical assistance, training, or materials. The other thing that I will say is that the materials that I referenced during today's webinar, including our model policies and the materials from the center, will be available on the webinar webpage after this session, along with the recording of this session. So with that, I'll wrap up today's presentation, and again, thank you everyone.